trials is not necessarily a last resort. Like if you're not at time of diagnosis, if you're not talking about trials, you're doing yourself a disservice. Like going to SCRS, that was like enlightening and eye-opening, and taking that back to my families was just, it was empowering to me. And to talk about some of the things they talked about there of like trials is not necessarily a last resort. Like if you're not at time of diagnosis, if you're not talking about trials, you're doing yourself a disservice. Like, and you know, when we're working, like I see the difference between frontline leukemia treatment in San Diego versus Sandusky. Like I see it and I'm like, the standard of care is not necessarily out there. The options available, the access to these things is not necessarily available. And I love saying to a family, like, look, just do the due diligence. Like I'm never gonna give them a recommendation about treatment, but I am gonna tell them information is your friend. And I'm telling you, learn as much as you can, go to your local groups that are advocates for you, and do not just necessarily take standard of care. Do the work, because the parents of the patients that are the greatest advocates for their kids generally have a better outcome. And it doesn't always work that way, but you have to know everything. And I feel like an ambassador to the clinical trials of the world, and to say like, these are not a last resort. You need to know what's out there because you never know.